Well, we learned something a little bit disturbing over the weekend, something that a lot of people had a fair amount of intuition and antennas about, children that died from the COVID vaccine. Tell us how this came out and why it really flew under the radar. It was a bizarre rollout of this information.
Since 2021, reports in the peer-reviewed literature of autopsy-proven COVID vaccine deaths in children have been published. In fact, one by Gill and colleagues, 2 teenagers after their second shot of Pfizer. I mean, these are clear-cut published cases. Now the CDC, over the holiday, from a leaked memo, says that they knew about 10 deaths that they're sure is due to the COVID-19 vaccine among children among 96 reports of death that they had. And to clarify, this is the FDA, not the CDC. So a leaked memo out over the holidays, no press release, no call for independent evaluation, no call to pause the vaccines. They're still on the childhood schedule down to babies 6 months of age if they have some additional medical problems. This is a very bizarre turn in this entire vaccine debacle.
So, Doctor, what would be the right, proper next step? Not sure that the government will take it, but given what we know now about the risk of children, 96 reported deaths, 10 confirmed, and there's probably more in the literature that I've read even. What should RFK Jr. do based on this memo that came out this weekend?
Well, the CDC has, as my last check on the vaccine adverse reporting system, they've got 19,480 deaths after the vaccine, a couple thousand that occur right after the shot. I mean, the only thing to do is to suspend all of these vaccines. If there was 10 deaths with a pediatric drug, immediately that drug would be recalled and it would be pulled off the market and there'd be an investigation. This is really the first concession that the U.S. FDA has had on what the public has watched since 2021. So I think the quick action steps are pause the vaccines, pull them off the market, get an independent review committee together. It's not FDA, not CDC. We're talking about independent scientists and doctors who can review all of these cases, read the vignettes. Remember, when the CDC gets a VAERS report, they have the patient's email, phone number, address, the doctor. They have a ton of information. All the patients, the families of the deceased, they should be interviewed to figure out what went on, and Americans deserve the truth.